Welcome to ASWB MSW exam practice test. Our topic today is practice test number 5. Use the link in the description to download the app on the App Store for free practice tests. Number 1. What is the type of group that incorporates spirituality into recovery? A. Spiritual group. B. Orientation group. C. Relapse prevention group. D. AA and NA self-help group. The correct answer is A. Spiritual group. Explanation. The 4 groups have different features. Orientation groups that give information regarding treatment philosophy protocols. Spiritual groups that incorporate spirituality into recovery. Relapse prevention groups that focus on understanding and dealing with behaviors and situations that trigger a relapse. AA and NA self-help groups utilize the principles and philosophies of 12-step programs. For family and friends, Nar-Anon and Al-Anon groups provide support. Number 2. Which one is true about the social planning model of community organization practice? A. The workers' roles include that of advocate, activist, and negotiator. B. This approach is pursued by elites on behalf of disadvantaged groups. C. Strategies include fact-gathering, publicity, lobbying, and political pressure. D. Tactics may be consensus or conflict. The correct answer is D. Tactics may be consensus or conflict. Explanation. The social planning model of community organization practice is summarized as follows. Focus on problem solving through fact-gathering, rational action, and needs assessment. Tactics may be consensus or conflict. The workers' roles include researcher, reporter, data analyst, program planner, program implementer, and facilitator. Answer A belongs to the social action model. Answer C belongs to the social reform model. Number 3. How do you feel today? Okay, happy, or very happy. What does this example illustrate? A. Nominal scale of measurement. B. Interval scale of measurement. C. Ordinal scale of measurement. D. Ratio scale of measurement. The correct answer C. Ordinal scale of measurement. Explanation. The ordinal type allows for rank order, first, second, third, by which data can be sorted, but still does not allow for a relative degree of difference between them. Examples include, on one hand, dichotomous data with dichotomous or dichotomized values, such as sick versus healthy when measuring health, guilty versus not guilty when making judgments in courts, wrong or false versus right or true when measuring truth value, and, on the other hand, non-dichotomous data consisting of a spectrum of values, such as completely agree, mostly disagree, completely disagree when measuring opinion. Number 4. The communities Lave and Wenger studied were naturally forming as practitioners of craft and skill-based activities met to share experiences and insights. What does the example illustrate? A. Social policy. B. Community organization practice. C. Political approach. D. Private organization practice. The correct answer is B. Community organization practice. Explanation. A community of practice (COP) is a group of people who share a craft or a profession. The concept was first proposed by cognitive anthropologist Jean Lave and educational theorist Lave Wenger in their 1991 book Situated Learning, Lave and Wenger 1991. Wenger then significantly expanded on the concept in his 1998 book Communities of Practice, Wenger 1998. Number 5. Kleptomania is not linked with which of these following factors? A. Neglect from parents. B. Mood swing. C. Eating disorder. D. Substance abuse. The correct answer is A. Neglect from parents. Explanation. Kleptomania is a complex disorder characterized by repeated failed attempts to stop stealing. It is often seen in patients who are chemically dependent or who have a coexisting mood, anxiety, or eating disorder. People with this disorder have an overwhelming urge to steal and get a thrill from doing so. The recurrent act of stealing may be restricted to specific objects and settings, but the affected person may or may not describe these special preferences. People with this disorder usually exhibit guilt after the theft. Number 6. The family system is made up of which of the following subsystems? A. The marital relationship, the parent-child relationship, and the sibling relationship. B. The marital relationship and the parent-child relationship. C. The marital relationship and the sibling relationship. D. The parent-child relationship and the sibling relationship. The correct answer is A. The marital relationship, the parent-child relationship, and the sibling relationship. Explanation. Disequilibrium of the normal family homeostasis is the primary motivation for change according to this perspective. The family system is made up of three subsystems: the marital relationship, the parent-child relationship, and the sibling relationship. Number 7. What type of delusional disorder makes patients believe that he or she has a physical defect or medical problem? A. Persecutory type. B. Somatic type. C. Jealous type. D. Erotomanic type. The correct answer is B. Somatic type. Explanation. Delusional disorders are characterized by the presence of a persistent delusion, which can be persecutory type, jealous type, erotomanic type, that someone is in love with a delusional person, somatic type, that one has physical defect or disease, grandiose type, or mixed. Number 8. Which of the following antipsychotics requires frequent blood testing due to the risk of agranulocytosis? A. Risperidone. B. Seroquel. C. Zyprexa. D. Clozaril. The correct answer is D. Clozaril. Explanation. Among the newer antipsychotics, Clozaril requires frequent blood testing due to the risk of agranulocytosis, a blood disorder that decreases white blood cells and increases the risk of infection. Number 9. Which of the following is true about roles of the therapeutic relationship in crisis intervention? A. Use of the relationship as a corrective experience is emphasized. B. The client is encouraged to be active. C. There is a maximal focus on transference or countertransference. D. The worker's role is authoritarian. The correct answer is B. The client is encouraged to be active. Explanation. The roles of the therapeutic relationship in the crisis intervention approaches to practice are as follows. The worker's role is based on expertise. It is authoritative and directive. The client is encouraged to be active, to be reality-oriented, and to work toward finding new methods of coping with crisis. The use of the relationship as a corrective experience is not emphasized. There is a minimal focus on transference or countertransference. Number 10. A social worker bumps unexpectedly into an old client at a civic event in a large town. Both are surprised to see each other. In this situation, it would be best for the social worker to A. Take any cue the client offers as to how to respond. B. Smile and quietly and discreetly nod a greeting. C. Smile and openly voice a greeting in passing. D. Warmly greet the client, walking up to shake hands. The correct answer is A. Take any cue the client offers as to how to respond. Explanation. In a situation such as this, it is important to follow the client's lead. The client may feel uncomfortable and not wish to encounter this part of the past. Or, he may be in the company of someone who could ask about how they know one another, putting him in the situation of unwanted disclosure or deceit. Any attempt by the social worker to script the encounter, quiet nodding, smiling, coming up to shake hands, could be unwanted and thus should ideally be avoided. If, however, the client smiles and nods, or voices a greeting, or comes forward to shake hands, then the situation becomes clear, and responses in like manner would be appropriate. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.